Imagine waking up to a new season of respiratory viruses like COVID-19, RSV, and influenza, wondering if the vaccines we're relying on truly safeguard us. That's the heart of the matter here. A groundbreaking review by experts aims to bridge the knowledge gap on vaccine safety and effectiveness. But here's where it gets controversial. Amidst shifts in federal vaccine guidance, this independent analysis steps in to offer clarity for the 2025 to 2026 vaccination efforts against these viruses. Building upon the recommendations from the 2023 to 2024 Advisory Committee on Immunization Practices, ACIP, a group of infectious disease specialists from across the United States carried out a comprehensive systematic review and meta-analysis. Their work provides fresh evidence to guide decisions about vaccinating against COVID-19, RSV, and influenza for the upcoming season. Point 1 For beginners diving into this topic, a meta-analysis is essentially a way researchers combine data from multiple studies to draw stronger, more reliable conclusions. It's like piecing together a jigsaw puzzle from various sources to see the bigger picture. Recent upheavals in federal vaccine advisory processes have thrown immunization recommendations into disarray, highlighting the urgent need for unbiased evidence reviews, states lead author Jake Scott, MD, from the Department of Medicine Med/Infectious Diseases at Stanford University School of Medicine in Stanford, California, along with his team. This thorough examination of vaccine evidence received backing from the Vaccine Integrity Project at the Center for Infectious Disease Research and Policy, CIDRAP. CIDRAP, established in 2001 at the University of Minnesota, kicked off this project in April. The announcement press release described it as an initiative to rally professionals nationwide in the immunization field to collect input on how independent organizations can bolster vaccine policy, information, and uptake across the country. In simpler terms, it's like creating a community forum for experts to ensure vaccine advice remains trustworthy and free from undue influences. What you need to know. Drawing from over 500 research studies, the findings affirm that vaccines for COVID-19, RSV, and influenza offer significant protection against severe outcomes like hospitalization, with effectiveness rates often ranging from 45% to 70%, varying by the vaccine type and the group of people receiving it. Rare but serious side effects, such as myocarditis, inflammation of the heart muscle, or Guillain-Barré syndrome, a neurological condition causing muscle weakness, were not common. Importantly, the data revealed no heightened risks for complications in pregnancy, and some vaccines even provided perks, like a reduced chance of preterm births. Research also indicates that administering COVID-19, influenza, and RSV vaccines at the same time results in immune responses and safety profiles that are just as good as spacing them out, paving the way for more efficient vaccination approaches in the 2025 to 2026 season. This review was put together by academic researchers and frontline clinical experts over a 12-week span. Their goal, as they put it, is to equip doctors, medical groups, public health workers, insurers, and policymakers with up-to-date data for the 2025 to 2026 respiratory virus season. The team incorporated randomized controlled trials, RCTs, which are like gold standard experiments where participants are randomly assigned to groups, and observational studies covering 4 main areas: U.S. disease monitoring data, lab-verified vaccine efficacy or effectiveness, safety profiles, and how well vaccines work when given together. From an initial pool of 1,406 studies screened in full, they selected 511 for the final analysis, including RCTs, 12%, cohort studies, 24%, which track groups over time, case control studies, 16%, comparing people with and without an outcome, and other observational designs, 48%. Let's break down the efficacy results. For COVID-19 mRNA vaccines targeting the XBB.1.5 subvariant, combined effectiveness against hospitalization was 46%, with a confidence interval of 34 to 55, from cohort studies and 50%, 43 to 57, from case control studies, though protection dipped for those with weakened immune systems. Against the KP.2 subvariant, case control studies showed 68% effectiveness, 42 to 82. Vaccinating mothers for RSV to shield infants, using nirsevimab for babies, and RSV shots for adults aged 60 and older all demonstrated at least 68% effectiveness in preventing hospitalizations. Flu vaccines yielded a combined effectiveness of 48%, 39 to 55, in adults aged 18 to 64 and 67%, 58 to 75, in children against hospital stays. On the safety front, here's what stood out. Myocarditis linked to COVID-19 vaccines appeared in 1.3 to 3.1 cases per 100,000 doses in teenage boys, with fewer incidents when doses were spaced further apart. The RSV vaccine correlated with 18.2 extra cases of Guillain-Barré syndrome per million doses in seniors. RSV didn't raise preterm birth risks when given between 32 and 36 weeks of pregnancy. COVID-19 shots during pregnancy weren't tied to miscarriages, birth defects, or stillbirths, and most studies even linked them to a lower preterm birth risk. Regarding combining vaccines, giving COVID-19 and flu vaccines together showed similar immune responses and safety compared to administering them separately, based on 17 studies, with comparable findings in adults 65 and older, from 5 RCTs. Administering all three, COVID-19, RSV, and influenza, together yielded acceptable immunogenicity and safety profiles. Overall, the researchers conclude that the evidence backs the safety and efficacy of these vaccines for COVID-19, RSV, and influenza during the 2025 to 2026 season. These latest insights confirm that vaccinations significantly cut the risk of severe health issues for various groups, with serious vaccine-related events like myocarditis and Guillain-Barré syndrome being quite rare, report Scott and his colleagues. And this is the part most people miss. While the data paints a reassuring picture, debates rage on about vaccine mandates, long-term effects, and whether independent reviews should carry more weight than official guidelines. Could this project be a game-changer for restoring faith in immunizations, or does it risk sowing unnecessary doubt? References: Scott J., Abers M.S., Marwa H.K., et al. Updated evidence for COVID-19, RSV, and influenza vaccines for 2025 to 2026. N. England J. Med. Published online October 29, 2025. DOI 10.1056/NEJMSA 2514268. University of Minnesota. CIDRAP launches Vaccine Integrity Project. News release. April 24, 2025. Accessed November 17, 2025, https://twin-cities.umn.edu/news-events/CIDRP-launches-vaccine-integrity-project. Newsletter. Stay ahead of emerging infectious disease threats with expert insights and breaking research. Subscribe now to get updates delivered straight to your inbox. What do you think? Are independent vaccine reviews essential for public health, or could they complicate matters further? Do you agree with the findings, or do you see potential flaws? Share your opinions in the comments below. Let's spark a discussion.